All right. Well, without further ado, I'm very excited to say that we have Adam Masloski here to speak to us today about the Boundary Waters Care Center and the state of nursing homes in the state and country. And so this is a very timely presentation, something that we all have a very vested interest in understanding and learning about. Adam has been an Eliite for 17 years and has worked for the Boundary Waters Care Center for 15 years. He has a master's degree in health service administration, and he is the perfect candidate to be learning about this topic from. So we're super excited that he's here. Thanks, Adam. Come on up.
Oh, hey, thanks for having me, you guys. As Lacey said, my name is Adam Masloski. I'm the executive director at Boundary Waters Care Center. That's Ely's Ely's nursing home had been a part of Ely Bloomington Community Hospital for many, many years. I actually don't know the year that the the hospital began in 1958, and some time thereafter the nursing home got going. Split off from the hospital approximately 12 years ago to form our own nonprofit corporation. At that time, that's when we formed our own board of directors that became Boundary Waters Care Center. We're currently licensed for 42, typically 30s. That had been a little higher prior to the pandemic, but we've seen kind of census drop off a bit over the course of the last couple of years. I've been with the facility, like Lacey was saying, for about 15 years. I playing bingo with folks and service role, did admissions and marketing, some HR, and then about 6.5 years ago, I licensed, and I've been running the place. It's an amazing place. We do both long-term care and short-term rehab, and do on-site PT and OT after hip replacements or knee replacements, or just when they need a little bit of extra help to get back home. And then we also do the long-term care and respite care. We aren't affiliated with Carefree Living next door. That's the assisted living. We are just our own standalone nonprofit corporation. Over the last couple of years, we've seen a couple of things happen, and it's led to some financial struggles for the facility. Prior to the pandemic, we would average 37 to 38 residents. Our revenue stream, basically, of our revenue stream is the folks. Hospital do Meals on Wheels in town, but when we saw a sharp census over the last couple of years, we've averaged around 30 residents, so that 7 to 8 on average. That equals a drop in our revenue. And seen a lot of workforce and had to rely on more agency staffing. We call it pool or agency staffing. Take care of people. Right now in nursing homes in the state, there's over 20,000 open positions. That's statewide, so it's not an issue that isn't being dealt with elsewhere. But with our decrease in revenue and the increase in costs associated with agency staff, we've basically seen a couple of years of financial losses. It's gotten to the point where we've kind of burned through a lot of our reserves. And so we, as a team over at Boundary Waters Care Center, decided to appeal to the public for fundraising, which we have been doing. And then also get in front of groups like you and the city and pretty much anyone I can get in front of to talk about how great Boundary Waters Care Center is, and talk about some of the legislative priorities, because it is being spoken of quite a bit down at the state level and at the federal level as well. But there needs to be an investment in long-term care, and with the state surplus being what it is, this is a time where they should be able to do that. Wages needs to be addressed, but another issue that we run into is the way that we receive reimbursement from the state government. Boundary Waters Care Center, just to back up a little bit, was in a similar position about 7 or 8 years ago, where the funding wasn't keeping up with the care that we were trying to get. We were in danger of closing then, just as we are now. And through some legislative push, they passed critical access nursing home funding. Our hospital here is a critical access hospital as well. And that basically allows like a 100% cost reimbursement. For what they're spending, they get reimbursed on. And that translated into nursing home funding through that critical access nursing home funding program. And that became what's called a value-based repayment program, which is that reimbursement on costs. And it worked well for several years. We would get reimbursed basically on what we spent last year, and that would translate into the resident rates. For a variety of different reasons, the pandemic being one of them, the review of those cost reports has the time it's taken for them to look and audit those cost reports and give us those costs back on our rates has stretched out to almost 2 years. So we aren't spending now based on what we spent last year. We're getting reimbursed now on what we spent 2 years ago. And as you can imagine, I mean, anyone that goes to the grocery store realizes that things have gone up quite a bit. So not only have we been utilizing more agency staff, but we're spending more on keeping the electricity on purchasing food, on heating the place. Everything costs more, and it costs much more than it did 2 years ago. So that's one of the big issues, is that funding gap and trying to get that closed at a legislative level. There are a couple of current bills out there at that level. The House has HF 733, which directly impacts wages for nursing homes. They want to raise wages so that we can pay CNAs and our direct care staff kind of what they deserve. Right now, an average CNA in the state makes about $17 an hour. There are many private businesses that are paying that much to, I mean, not to dissuade that it isn't good work, but hitting a cash register button and caring for a vulnerable adult, I see as different. And I think that our caregivers deserve a lot more money. We aren't able to do that because of the funding not coming in time, but this HF 733, that directly impacts wages. It's so that we can see an increase in revenue stream to be able to directly send that to our employees. SF number 7 in the Senate is a bill that would create a rate add-on. It's called the Caregiver Stabilization Act. And that does provide a rate increase for nursing homes as well. And then the Governor Walz did put in his recent budget, critical access nursing funding once again, which is that funding that we used as a stopgap the last time that we were in financial issues. So the one thing that I'm really trying to get people to do is to pressure our legislators to make nursing homes and skilled nursing a priority. When we are understaffed, we are unable to take new residents. That creates a backlog in the hospitals. It affects the whole continuum of care that we see in the state. When hospitals can't discharge people, then they're full and can't take in, new folks. We're part of that continuum because we take from the hospital to rehab, get back home, or get into a long-term care setting. Our legislatures, I've been in touch with both Representative Scraba and House Child, are very sympathetic to what's going on in long-term care. And I believe that we have their ears, but anything that you all can do to reach out to them, if you agree with the fact that long-term care is important, would be very much appreciated. Yeah, I also have here several slides. This is from a presentation that was done by Leading Age and their consulting group. And I'm not going to go through the whole presentation, but there are some visuals that I can use to kind of illustrate some of the points that I was making. Throughout the state, the biggest issues are occupancy and workforce. The use of staffing agencies have soared, and 58% of nursing homes in the state are limiting those admissions. That's what I talked about, that jams up the hospitals. According to McKnight, 23,000 open positions in long-term care right now. This is just showing what our margins have looked like for the course of the pandemic. The blue bar is the patient revenues margin, and the reddish bar is the operating expense margin. You can see that this is numbers for nursing homes in the entire state, and you can see that those have dropped over the course of the pandemic. This is occupancy trends. This is at a national level. And you can see in 2020, that's when we saw that steep decline. Now things have started to come back, but the median occupancy has dropped precipitously, largely due to nursing homes not being able to take new patients due to not being able to find staff. Oh, I hit the button way too much. Sorry. I got impatient. Yeah.
Let me know when to stop.
Okay.
There's a lot of info here.
There's a lot. Okay, stop. I'll try and go.
Back a couple.
This is just Minnesota occupancy trends. Very similar to what you saw at the national level. But they consider, the 2020, we saw the steep decline. 2021 was considered somewhat of a recovery year, but we still haven't quite got back to those occupancy levels prior to the pandemic. Pre-COVID, median occupancy was around 85% in the state. Just another slide showing those occupancy trends. These are all nursing homes within the state. This shows the workforce trends by different care areas. The all ambulatory section, that would be like our clinics, our outpatient hospitals, our outpatient rehab facilities. You can see that drop in workforce around the pandemic and then how it kind of bounced back in those ambulatory settings. Hospitals and nursing homes, it's been much more difficult for that workforce to come back. What occurred quite a bit was we were faced with having to staff additional units while not really having workers on the bench, waiting to work to be able to staff those units. A lot of our workforce got COVID at some point and had to be out for a quarantine period. That would happen suddenly. We get a call, hey, I have COVID, I have to be out for the next 10 or 14 days, depending on when in the pandemic that occurred. So we were forcing our other staff to pick up shifts, work overtime, do doubles, cover for those that were out. It burnt out a lot of the workforce in the state. You have all these caregivers, they care so much and they want to do a good job and provide good care, but you can only work them so much. And especially in a hospital and a nursing home setting, we're open 365 days a year, 24 hours a day. We can't say we're going to close the business for a couple of weeks because we're having some workforce issues. We have to stay open, so we have to force these people into keeping working, and it burnt out a lot of the workforce. We saw a lot of early retirements, and we saw a lot of people just leave to do other things. So. That brought in agency staffing, and this is just nursing pool utilization throughout the country here. And you can see Minnesota's kind of in a mid-range. This is how a nursing pool, that's what we consider the agency staff, went up over the course of the pandemic. You can see that sudden spike. That's the way that we backfilled a lot of those positions. There's another slide showing the gradual incline in nursing pool utilization. The dark blue bar is CNAs, the reddish bar is LPNs, and the lighter blue bar is RNs. So across all of those skilled positions. We've also had to increase wages across the boards, trying to attract new workers. And this is just showing those segments on how wages have gone up. In the ambulatory settings, the settings like the clinics and outpatient, they've gone up about 9.9% over the last 2 years. Hospitals 13.8%, and nursing homes we've seen an increase in wages of 18.3%. That's significant. It shows that we are trying to attract workers back into the industry. That workforce just isn't out there right now. Just another slide showing the growth rate of average hourly rates for nursing homes. Wage increases by discipline. This is showing the CNAs, LPNs, and RNs. Basically paints a picture that, we were seeing that the workforce was dwindling and did try to increase some wages despite not getting reimbursed for it for 2 years in a lot of cases. This just kind of shows a timeline of that cost reporting that I was talking about. we'll receive a desk audit on our cost report ending, our fiscal year ends at the end of September 2021. We won't receive those rates until sometime in July or August of 2023. So it's just illustrating that we are seeing a very large gap in what we're seeing for those reimbursements. These are kind of some smaller numbers, but it does show that our rates do go up over time. This bottom number 303 in 2021, that's the average daily rate for a nursing home resident. 2022, we saw that go up about $35. It goes up each year, but we don't see that money for 2 years. We don't see that realization in rates. There's just such a gap in that. That's led to a number of closures. 106 nursing homes have closed since 2000. They've seen more closures since 2015, more closures in the last year since any in 2015. This just shows a map of some of the areas of the closures. They are seeing, I believe, on their most recent survey, 60% of nursing homes in greater Minnesota have said that they're in danger of closing. Basically, there's two groups, those that are facing closure and those that are moving closer to closure unless something changes. They share many of the same features. They collected some data from 66 nursing homes. Several were over 90 plus days behind on accounts payable. Many more were 31 to 90 days behind on accounts. And many more of them were 90 days behind on accounts payable for therapy vendors. The median operating margins of facilities considering closure right now is negative 17.8%. This is just some more data on the financial hardships of nursing homes in the area. This presentation was done last fall. So it kind of looked at the second quarter of last year. The median facility at that time was losing $230,000. If that represented the average for the year. There was 30% of nursing homes that were 10% worse. 20% of all nursing homes in the state are behind on payments, 10% have exhausted reserves, and some are considering selling to larger organizations so that they can prop them up. We don't have that as an option here in Ely. Our nursing home being small, 42 beds is considered quite a small facility. For years, if some organization came across and look into buying us, we would have listed, but no one wants a small facility such as ours. That's what it really comes down to. Typically, when we're running operations positively, the nursing home would only clear about $80,000 to $100,000 in net income a year. We're really kind of a break even proposition. We want to be here for the community. What we do make, we put back into the facility, we put back into wages, and we kind of just hope to break even each year. They did a little survey and talking about operational issues and what people are most concerned of. Staffing availability, staff turnover, and loss of experienced staff. Ely is experiencing that. More than once a week, leadership staff are working shifts providing direct care or other services, including housekeeping, dietary, etc. We've had to do that. I am blessed to have an amazing staff at the nursing home of a core group that really cares about the facility. I've had situations during outbreak status or different situations where we've had no CNAs because they've either been all sick or we just don't have them available. So we've had managers come in and work the floor to take care of people. That's happened quite a bit. Nursing facility is currently limiting census to an amount below capacity because we're unable to staff with full capacity. That's occurring in Unity. Facility is receiving little to no interest for posted vacant positions. I would say that has begun to turn around a little bit. We have gotten some recent CNA applications. We have an amazing nurse educator on staff who is helping train folks that come in and that are interested in becoming CNAs. And we have recently got a few applicants. That's been positive. Our daily census remains well below pre-pandemic levels, and the nursing facility is unable to provide wage increases needed to compete with other employers. We just do not have the revenue stream in order to do that right now. The nursing facility has physical plant deficiencies that require an expenditure of at least $100,000. We do have an aging facility. I did recently write a grant and we were awarded $95,000 through the Blandon Foundation for capital improvements. So that piece is not an issue. However, that money is just to be used for capital improvements. It can't be used for operational funding at this time. It's great, and I really appreciated them giving us that grant because we can improve a lot, but we have to be able to keep our doors open to worry about fixing anything. We're not part of a multi-facility organization. We've had no breaches in financial institutions, and but we are getting lots of referrals, and at times we have to deny those just due to the fact of our staffing being low. That's all the doom and gloom slides that I had. It's a problem statewide, and it's not just an Ely problem. Like I said, the 23,000 jobs that are open just in long-term care are a big deal. Last year, the legislature ended session without doing anything for long-term care. I have a lot more hope this year that something will get through. It's become more of a hot topic issue. I think there is a surplus there that should be used for long-term care. It helps Democrat or Republican. It does help when both are of one persuasion, because that allows anything that gets included into the bills to actually get through. Less infighting that way. I think that they're going to look at wages in particular, and I think that they are looking at the closing of that gap through funding. But if you're to leave here today with anything, I would ask that you reach out to either Senator Housechild or Representative Scraba and just hopefully say what I've been saying, that you believe nursing homes are important, and that we want to be around for years and years to come. I continue to write grants. I've been talking with the city. I've been talking with the hospital foundation. I will turn over every rock I can find to keep the place running. I think that the legislation will come through for us. At this point, I'm worried about us making it to that legislation. I wouldn't be out and about trying to get everyone on board with this if I thought we would just be fine and be able to make it. We need some help right now. And I love the place, and I really, really love the people that we care for. You know, every day there's folks that come over to eat lunch with their loved ones, and they sometimes don't leave until dinner time. If we weren't here, the next closest facilities are 50 miles away. It'd be Virginia, Cook, Aurora, and that's quite a drive. And a lot of the loved ones that are coming and visiting, you know, it's their spouse, it's their mom, their dad, and it's the community. We take care of all of our neighbors, you know, it's, there's rarely an admission that comes in that one of my staff didn't live down the street from or knew all their lives. And I think that that's something special to have in the community. So that's my spiel, but I'm willing to answer any questions.
I have a question.
Yeah.
How did you prevent burnout or manage burnout in a particular period of hardship or even in an ongoing way? Like, what's your burnout strategy, burnout prevention strategy?
Like for myself,
Yeah.
I don't have one. I just keep going. It's tough being an administrator for a nursing home. You're the one that gets called on everything, but I went back to school to become the administrator at Ely's nursing home. I never in my life thought I would work for a nursing home. I have a master's in journalism and worked in newspapers for quite some time. And when I wanted a part-time job, I was like, yeah, playing bingo with old people, I would love that. That sounds great. So I started doing that on the weekends. And I just fell in love with the place, and they're amazing. They have these great stories from Ely. I mean, I hear about the old CCC camps that they had in town and everything from Ely's history. And it's just amazing hearing it all. So I've fallen in love with the place, and I will go down fighting with it until the day I die, just because I love the facility so much. So I do get burnt out from time to time. But that's part of the job. So yeah.
Thank you. So I assume that the people you can't take right now are getting cared for at home. Can you say more about those resources and cost effectiveness and?
Yeah, home care is a big part of that caring continuum. Some folks that are able to then go home, access home health care services, which is also lacking in this area due to workforce. There's a lot of situations in which Medicare will only pay for skilled services in the home. That would be things like additional therapy or taking care of wounds, something of that example. A lot of folks just need some homemaking or housekeeping type help to really stay in the home. And that is not allowed to be funded or by either the Medicare or Medicaid system. That requires private payment. There is legislation that's out in that Caregiver Stabilization Act that would allow for some of that to be billed. But we run into the same issue here. Home healthcare agencies haven't wanted to come into the Ely area because of the workforce issues and the kind of ups and downs of the need. There's times when there might be 20 people that require services, and there's really times when there's only a couple that need services in the community. And so they can't maintain those staffing levels long-term to, when they don't have the work, they can't keep the people, and people want a job that they can count on long-term. So that's one of the issues that they run into with the home health care.
Adam, both you and I are somewhat familiar with this because I spent some time in a nursing home earlier this last year. And that has to do with patients who, well, let's call them psychiatric patients. Where do you put them? I mean, you're obligated to take them. You can't put them out on the street. They require a whole lot of extra care. They're a problem many times with their roommates, such as it was for me. But like I say, you've got to serve them somehow, and I wonder if you have any comments on this.
Yeah, that's been a struggle in long-term care, in general over the years. A lot of hospitals, for better or worse, view long-term care facilities as somewhere that they can more or less push those mental health issues onto. Long-term care facilities are required to do an assessment that shows that their primary diagnosis isn't a mental health reason. That's an effort to try and get them to locations that may be able to better serve them. There are not a lot of those in the state. Bemidji operates a behavioral health unit. There's one down in southern Minnesota near Hastings. That service is lacking in the continuum as well. And as a long-term care facility, we tend to be the end of the road for a lot of those discharge plans from the hospital. So it does result in us, although we try and screen our best to not be taking that type of patient, we can end up with some of those that have more behaviors and things like that. It also is a struggle as we take care of folks that are suffering from dementia and Alzheimer's, and throughout that progression, there often leads to a period of time when those behaviors can rear up. The more that we know about that progression and how Alzheimer's works, the more that we can train staff in how to react to those things. Sometimes, for an example, a person with severe dementia or Alzheimer's might be yelling or screaming, but it's because they need something else. It's because they need something like a glass of water and don't know how to express that. And so some of it goes into us just needing to educate our staff on how to better deal with some of that as well. So.
If the legislature passes the legislation, you hope they will, that probably won't happen until this spring.
Yep.
Correct? And so I guess my question is, how long can you hang on? And is there any chance of getting any federal help? And both my mother and my aunt were residents at the nursing home, and we never worried about them while they were there. So I want to say thank you for that.
Thanks. Right now, the reality is we're living paycheck to paycheck. I'm deciding which vendors to pay and which we can put off till next week. It's kind of, if you had a family and a full-time job, it's juggling those payments as to when you can pay bills. We have raised around $32,000 through our fundraising efforts. We sent out letters to a lot of the community asking for donations. Every little bit has helped there. I am talking to the foundation at the hospital about helping with some gap funding, and then ongoing discussions with some other funding sources that would not like to be named, but we could see dollars from the government by July from the legislation that I'm looking for. It's going to be close. I think that we can make it. I think that I have been with the facility long enough and understand the finances of it enough to juggle things until then. I hope that it's enough when it does come. And right now, everything that I'm hearing is positive from the state, at the state level. From the federal level, we have not heard as much on the positive end of funding. They tend to look at skilled nursing in a slightly different way. trying to fix some of the issues, some of their legislation is, because there are issues in long-term care. We're a highly regulated industry, but they're looking at forming like workforce committees and workforce boards to kind of oversee they kind of look at it as like, well, they should be paying livable wages. We need to do a study on it and see what those wages are. And I think I think the country as a whole will have to come around to the fact that long-term care is important and needs more funding. Just in Minnesota, in 2 years, by 2025, there'll be 50,000 more people over 80. For example, that's going on throughout the country. The federal government is much more slow to come around to some of those things than they seem to be doing at the state level. So
if someone is interested in donating, where would they go?
they can get in touch with me, or send a check to Boundary Waters Care Center. It's 200 West Conan Street. And I'm always happy, even after the other questions, if anyone wants to talk further. My phone number, my direct line is 218-365-8045.
So you're waiting for progress of a bill in the House of Minnesota. The Minnesota House, what's the identifier? That's the number.
The bill in the House is HF 733. And that directly affects what we would be able to pay in wages. If that were to pass as written, I would be able to give everyone in my building, we employ about 50 people, a $5 to $6 an hour wage increase. That I believe would be able to attract people back into the business. On the Senate level, there's a bill, it's SF number 7, and that's the Caregiver Stabilization Act. That would provide a one-time rate add-on to get us to our next cost report revenues. They realize that there is a large gap in that funding right now, and they're willing that in that bill, they're suggesting that, well, we'll give folks a one-time payment and then we'll fix that process in the meantime, basically. So,
Who is supporting 793 in the House?
733, 733. And I believe Hoffman has been the name that I've heard. But I would have to double check on that.
Do you know whether there was anything in the, I think it was called the Build Back Better bill at the federal level that would have helped you, the big social infrastructure bill that didn't make it?
Yeah, there's one thing specifically related to nursing homes that would help nursing homes in the grand scheme of things, but it was a mandate that we provide 24 hours of RN coverage per day. Right now, we're mandated to provide at least 8 hours of RN coverage. I'm all for more RN coverage for our facilities. I think that's the skilled of the skilled when it comes to nursing homes, but we don't have RNs. We don't have enough. It's like providing a mandate and not giving us the resources to follow through on that mandate.
Hi, someone had told me that you might appreciate volunteers coming to help, like play bingo or do something like that. Is that true or?
Yeah, that's very much true. Through the course of the pandemic, we had to really limit who we could allow into the building. And so it kind of dried up our volunteer pool. Over the last couple of years, there was a section of time where we couldn't even let family members into the building. And it was sad for some of our residents. We had half the population saying they're scared of getting COVID, and the other half saying, well, you mean I'm not gonna be able to see my daughter for who knows when? But to get back to yours, volunteers are very much welcome. We do have to background check volunteers, but that's all that needs to be done, and we have plenty of fun stuff to do. Yeah.
I have several questions, but the quick one is this HF 733 and the Senate Bill number 7.
Yep.
Dealing with wages and stuff. Are you going to get the money from the state to then pay the additional $5 per hour raise, or you have to come up with it?
Yep, no, if HF 733 passed, for example, they would increase our what we are able to charge on our daily rate, which is determined by Medicaid. About 80% of our population is paid for by government assistance. So we would see an increase in those rates. We would have to develop a plan on how that increase is to be spent directly on wages. And follow that plan. We'd have to do some constant reporting on that. They want to know that that increase is going directly to wages.
And of course, then the issue is you're mandated to do that and you have to wait a long time to get reimbursed, I'm sure.
Yeah.
Yeah. As I said, several questions, and I'm thinking in my mind, I read something about how Governor Walz was going to spend the surplus.
Yeah.
And I think that was in the Minnesota Post or something. But it was like $684 million, if I remember correctly, for this sports stadium.
Yeah.
And it's obvious they have good lobbyists.
Yeah.
And so I'm first of all, I'm wondering, your funding sources from the city of Ely, if you will, from the county, region, and the state, like what percent, generally of that. And I guess for me, for you to get more money, it'd be nice to somehow have a bill saying it goes faster, without fraud and whatnot, because that happens in this country. But I don't know if there's some bill out there that's been proposed locally as well as nationally to speed up the payment, because that's obviously an issue. And the other is on increasing funding.
Mhm.
To me, nursing homes are more important than sports stadiums where the millionaires, the players are millionaires and stuff like that. So it's like a priority for our society. So again, on that, the funding sources, city, region, county, state, approximate percentage, I'm not going to hold you to it. And then I'm looking for someone to have crafted the bills rather than my coming up and writing my legislators. I want you to support nursing homes, like what bill has been crafted, and not only locally, but in Congress in Washington, D.C. Pete Stauber is part of the party that is in charge of Congress. And what's going on at that end, if there's a bill that he's introduced, or that we can lobby him to support so that you get more funding.
Yeah. Really at the federal level, we aren't seeing much at all being introduced just for nursing home funding. Around 80% of our income comes from the state in the forms of Medicaid payments. Those are set by the state and paid for by the state. Medicare dollars, which we consider the federal program, accounts for about 10% of our revenues, with private pay individuals kind of filling in the gap in between those two. We don't receive local funding or county funding. They are not in the business of providing funds for nursing homes. It's all at the state level, basically, is where it really comes from. Governor Walz did present a budget that will be used, to be debated about in both the House and the Senate. The House and the Senate will each come up with their own budgets as well. He did include critical access nursing home funding in this budget, which is that program that we used 8 years ago to kind of stave off closure at that time. That is specifically for rural nursing homes. And I remember doing the application at the time, and Ely's nursing home is about the most rural nursing home in the state. And so should that pass, that will help Ely's nursing home. That we haven't even seen the House or Senate budgets yet. There are legislatures working on additional bills. They aren't out yet. The two that are out right now are the HF 733, which would go to wages, and the SF number 7, which could provide some gap funding for that cost report issue. But I have talked with House Child Scraba, Rep. Zalesniker. She used to be a nursing home administrator and worked in long-term care for about 40 years. She's been great. She's out of Duluth area. There's people in our court, and there will be more legislation coming out. But I don't have any, this bill number or this bill number at this point. So we got to keep this swell going to get them to keep it at the top of their minds.
Are you hoping for more help from Blandon in the future?
I will continue to write grants through the Blandon Foundation. Yes, and I almost cried when we got $95,000 from them. I was like, this is amazing. I mean, our facility is 50 years old, and we need new call light systems. We need a new tub. We need, things like that. And when I'm worried about just keeping the doors open, I was like, okay, well, we can afford these things. So that was amazing to get that $95,000 from them. Yeah.
On the Medicaid stand, the states administer the Medicaid dollar, but the great bulk of the funding is federal, isn't it, on Medicaid?
Yeah, overall, but the state determines those rates.
The states
Yeah,
administer.
the state doles it out.
Right.
Yeah.
Still something more question.
We're gonna have these last 3 questions before we wrap up.
Yeah, I'm not a vet, but the closest place for vets to go is either Silver Bay for Mealy. We got a lot of vets here in this town. And Aurora's the next closest place. Is it a possibility for the nursing home to look at the contracting with veterans so they have a facility here, so they don't have to travel so far to people to see their family to Aurora or Silver Bay? Because then we're the closest place. We got not in here. We got a lot of vets in this town.
Yeah, and we have been in contact for some years with the Veterans Service Administration. And over the course of the pandemic, they closed any new applications to that program. But that's definitely something that we're interested in doing. They'll do, how they provide contracts is saying, we'll give you 1 or 2 beds that we will license for veterans, basically. And that's something that I do plan on to continue to follow up on. I believe that now they're talking about kind of releasing that emergency order for the pandemic, and they'll be opening up that application process again. So yeah, definitely something I've thought about.
Didn't the community college have a nursing program?
They did at one point, and now Vermillion does not have one anymore. Eveleth and Hibbing are the closest schools to have nursing programs. That state college system is kind of divvied up different colleges to kind of focus on different areas, and Vermillion has just chosen to kind of focus on like the law enforcement and the outdoor programs and things like that. So.
Okay, my last question for you, manifesting a dream. If you imagine getting an unmarked envelope in the mail, it's a check. What's your dream check amount?
Wow.
What's like, oh my gosh, if we could just get a $20,000 check, that would just I don't know, I'm just put a number out there, you know?
That would help us, you know, right now, when I factor in all the agency staff usage that we're using. If we can get our census back up to pre-pandemic levels, averaging 35, 36 residents, which right now we're at 34. So that's within range. We're still looking at $100,000 loss for the year. We have gotten into a little bit of a hole. And I would say that there's, you know, another 100,000 there to get out of that hole as well. And so, but that's year after year, losing $100,000. We just can't maintain that. So, but those are the general dollar figures.
So we're putting our energy out there. Someone is gonna send a $200,000 to the Boundary Waters Care Center. Thank you so much for being here today, Alex.